everybody. Welcome to another edition of Elevating with Marcia and Mike. I'm your host, Marcia Hawkins, along with Mike Athas. And today we got a great show on tap for you. We're going to be talking about the state of healthcare and health insurance and how it applies to all of us. Welcome aboard, Mike. How are you?
Marcia, I'm doing fantastic. How are you doing?
I'm doing good. So I wanted to do a show about this, a podcast about it, only because I do sell health insurance and have health insurance. You have health insurance. And I've noticed over the last year, there's been a major shift, one of which is people using online doctors, not only
Yeah.
for televisits, but they're also using them for lab work. And I found that kind of fascinating.
I've seen it as a growing trend in the industry, and in fact, our number one seller right now is all going to be virtual primary care, virtual urgent care, virtual telemedicine. I mean, you name it. It's like, do you really need to go see a doctor? In some cases, yes. I mean, don't misunderstand me. I think that there's always going to be a place for a doctor, but what I'm seeing is, in fact, I did some lab work within the last 3 months, and I didn't have to go into a doctor's office. I went into a lab and had my blood drawn, and then everything came back digitally, and then I had a virtual meeting. It's just that convenience. This might be a hangover thing from COVID or something where people don't need to necessarily go into an office. It's kind of like working remotely. You can do everything over the computer.
Yeah, it's kind of funny. I've said this and it applies to every facet of our lives. Be careful what you sign up for or wish for because it may take you in a direction you do not intend. And however you feel about COVID, but like even with the schools and the parents kind of got a bird's eye view about what was going on in the schools and then you couldn't get into your doctor so you had to do it virtual and then blood work. The big thing that I'm running into is people are saying that the doctors are not like they're just doing the standardized blood test. So,
Yeah.
like in our area, Lyme disease is pretty prevalent, and you have to kind of go through all these different layers before the doctor will order. I don't know the exact name of it, and I should have researched it before we jumped on the call. But it's there's more extensive Lyme testing that you can do than just the standardized one, and same thing with like thyroid. There's like a quick thyroid test that they do, but apparently there's another whole layer to that that people need to have done in order for it to accurately tell you whether or not your thyroid is functioning properly. So I think so you go on social media and there's all these functional medicine doctors on there saying, hey, for $500 a month, and sometimes it's less than that, you would know they don't accept insurance. So they've really become concierge doctors, but they're doing it
Huge.
virtually.
Yeah. Yep.
Yeah. And when you really think about it, unless you need a doctor to like look down your throat, look in your ear, or another oral cavity or whatever, but or if they need to look at a
Tell me
rash
how you really feel, Marcia.
or they need to look at some type of rash on you. You didn't sign up for this, did you, Mike?
The direction is not what I was expecting, but let's go with it.
But I mean, unless they need to physically, look at something, they're really what they're going to do is they're going to listen to your complaint. They're going to figure out what tests they want to order, and they're going to run in that direction. And I'm finding that like even some doctors are saying, you know what, I'm going to order all your lab work, and then I want you to schedule the appointment so I have everything in front of me. And
Yeah.
then I mean, I know now, when you make a doctor's appointment, they'll say, "Would you like a telephone consult, or do you want to come in, or do you want to do it via Zoom?" And my husband had to have a second opinion through a hospital down in Boston, and they did it all virtual. So,
Wow.
I mean, I just think it really, so it really, because I sell health insurance, one of the things, think what you want about Obamacare. The problem with Obamacare is that there are many providers that are not accepting it anymore, given that there's just too many, regs and rules that they have to follow by. And they're like, you know what, juice is not worth the squeeze. We're not going to accept Obamacare, or they're only going to accept certain plans on Obamacare. I have a client in Michigan, has to go 200 miles before he can find a provider that takes his insurance. So we've been getting a lot of complaints, if you will, about that. And so it really, again, I think the long-term solution is you really need to be proactive with your health so you don't get into a position where you need to go to the doctors every month. And you're not getting loaded up on prescription drug medications. And you really need to take a look at your, whether it's your own benefits package that you receive through your employer, or you're an employer and it's the benefits package that you offer to
Yeah.
your employees. This is becoming I think, a sticking point with hiring people. What does your benefits package look like? I mean, I think it's becoming more and more important.
I think it's massively important actually, and it's oftentimes overlooked. And I'll give you an example. So I'm on my wife's primary health insurance through her company. She's a W-2 employee. I'm obviously 1099 because everything we do is on a consulting basis or outside independent contractor. But we have our primary health insurance through Cigna, and
Mhm,
Cigna is a major provider, right? But where I
mhm.
live in Sarasota, Florida, the hospital the main hospital, Sarasota Memorial Hospital, doesn't take Cigna. And
Yeah, yeah.
so here is her company saying we provide all these great benefits, but we can't even go to the doctor here. It's like we have to switch primary care, switch everything. And so the solution in some cases is use that urgent care, or use the virtual care that's provided through there. But I think that even I mean, you really have to examine that, and what does it actually look like? Because I tried to jump on for my daughter had a cold the other day. We wanted to just get her checked out. But in order for her to get actual treatment, it took me an hour and a half of just sitting there in a waiting room, in like a Zoom waiting room, trying to get on to see a
Oh,
doctor. And
wow.
so you really have to look at it. Are the benefits, if you're the employer, are the benefits that you're providing to your employees, are those actually usable? Is that what they need? Is that providing them a better experience? Because ultimately, yes, you're there to provide healthcare, but you're there to make their lives better. I mean, they're putting their time, energy, and effort into building your business and making your business stronger. You want to make sure that you're giving them something in return for that. And I think that there's a lot of holes in health insurance right now, and there's a lot of gaps, and it's a changing, challenging environment where even if you do provide that full coverage, it might not be the best for all of your employees. So I think it's very much something that brokers are dealing with that. And I know we deal with that a lot, and we have some great products that help support it in the supplemental world, but. It's not a perfect system by any means. So I'm glad that you're able
Yeah.
to get in with your husband to Boston virtually. I think that's great. So
Yeah, no, it is. But like my daughter last night complained that her health insurance through her employer now doesn't offer her to go to her primary doctor that she has seen for
yeah.
30 years. And
Yep.
she's, really upset about it. And I just said, just pay cash. I'll pay it for you. And she was really, really upset about it. And I realized, that I really wanted to do a podcast about it because I listen to people complain all the time about, them, not being able to get in. I had one client that was telling me she had three surgeries scheduled, and every single one of them can't even talk today, kept getting canceled. And the reason was that the primary doctor left. So the doctor that was supposed to do the surgery left.
Yeah.
So she was like, all right, well, then they put her on another list with another doctor. She'd get a call 2 days before the surgery saying, oh, that doctor. So I asked a friend of mine who works in a medical office, and I asked her, I said, what is the problem? And she said, well, what's really going on now is, how, like, if you do lab work, it's automatically uploaded into your portal. And that's a federal law now. So
Okay.
anytime you
Yep.
have blood work, the results have to be put into your portal, and any patient can see that. Well, that prompts a proactive patient to then go in and start, talking with the healthcare provider, like, oh, I saw my white blood count was elevated. What do I do about that? So the doctors, when they're done, the primary doctors, when they're done doing their rounds, then they have to go through the portal and answer all those questions. Because sometimes the nursing assistant can go in and answer it, but she still has to consult with the doctor who was the ordering doctor of those said tests. So, it's spinning almost to the point of being out of control. And I think that, as a consumer of health insurance, as a a seller, a provider of health insurance, and someone who is very into functional medicine, I really started to realize that sometimes what you think you have for benefits are not going to get you what you need, number one. And number two, being more proactive about the preventative side of healthcare. I mean, I have a friend who's a doctor, and she was telling me, a guy came in, smoked a pack of cigarettes a day for 20 years, 40 years, whatever it was. And, he was a, why me? Did I get, stage 5 lung cancer? And she goes, well, I was kind of expecting this, so
Yeah.
it's really taking charge of our own health so that the benefits that you have are, you're able to utilize, but making sure that your benefits package is going to actually be there for you when you need them. And then lastly, really taking a look at it. Most people don't read their policies. Most people don't find out something's not covered until they go to utilize it. So I guess the moral of the podcast is just being more proactive, and maybe, when you are taking a new job, really scrutinize that benefits package to make sure that it's going to fit the needs of you and your family.
I think that's very well said. So you definitely have to scrutinize it, make sure that you are getting
Absolutely.
everything you need. So,
Absolutely.
and proactiveness is what it's all about. So
Yep,
yeah.
absolutely. All right, everybody. Thanks for tuning in. You've been listening to Elevating with Marcia and Mike, and we'll be back next week with another podcast with informative information. Make it a great week.